I mean, I've just always loved babies from a very young age. And when I started to job shadow and do internships and things like that, it was beautiful, but it was just too painful for me at the same time. And just going into the hospital and seeing these things like injuries, chronic diseases, other things like that, that can be prevented outside of the hospital through education, resources, connections, really having that community with you at the table when you're developing programs. I knew that I had to figure out what degree could I use to get to that, because I didn't want people to be sick. I didn't want babies dying through preventable injuries or just lack of awareness through parents. So that's what made me change my scope and go to Ball State University to pursue public health education. I went to Indiana State initially to pursue nursing, but then transferred to Ball State University for public health.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 68. Hi everyone, Omari Richards here. Thank you all so much for joining me. I greatly appreciate you all listening to this. Before anything, make sure that you subscribe, that you like, that you leave a review, that you share this with a friend who might find some value in public health and public health stories. And you can follow me on Instagram at the PH Millennial. This episode I really enjoyed sitting down and chatting with this person. She is launching a impact program, which is focused on helping people interested in certified health education specialist certification or CHES certification. So if you're interested in that, there's going to be a link in the show notes in the description. So be sure to tap into that and sign up, because I know a lot of people have been asking for help around CHES, and this is a great way to do that. And outside of that, there's just a lot of great information in this interview, and I know you all will enjoy. So enjoy. Today, we have a multi-talented leader and outreach specialist with a demonstrated creative and insightful approach to public health education, communications, social media, and marketing. She got a bachelor's degree in public health science and interpersonal relationships at Ball State University. She currently works as a director at a world-renowned medical center and also has a consulting business, Jenkins Public Health Consulting, LLC. You can follow on Instagram at Jenkins_public health. We have Brittaney Jenkins, BS CHES. Welcome to the show.
Thank you.
Yeah, I'm really.
Thank you for having me.
It is my pleasure. Always glad to connect with other public health people, especially I feel like public health consultants. I feel like a lot of public health students these days have a lot of questions around public health consulting and how to get involved in it and all of that. So I'm always happy to tell the story, because I feel like you get the story of public health story and then the consulting story, and it's interesting to hear how different people come into it. So I'm looking forward to hearing more about your story. And I guess to start, how are you doing? How have you been coping during the pandemic?
I've been doing well. It's been interesting. Working from home started for me in August 2020. So I didn't work from home immediately when COVID hit. And obviously I love being home. Well, I love my home. I'm very outgoing. I love being outdoors, really. But it was nice. It was nice to work from home, not having to get dressed and, commute 35 to 45 minutes every day. But then I did kind of struggle a little bit with not having that relationship with people that I typically have. I'm a touchy person. I'm like, hey, and I always enjoy meeting new people. So that was a challenge for me. But overall, it's been a good. Other than people dying and becoming sick, it's been pretty good.
Okay, and that is interesting that you shifted to online work or remote work like a couple months into the pandemic. How was that transition for you?
It was decent. It was decent. Having to deal with all the technology of bringing your work equipment home, and then the whole chair situation. I was not comfortable with my kitchen table chair, so trying to figure that out. But it wasn't too bad. It really wasn't. I'm very grateful that I had the opportunity to work from home, because a lot of people still were working, out in the field, like our nurses and doctors. So I was happy to not have to be exposed at all. So
Yeah, absolutely. Like if your biggest worry is if your kitchen chair is comfortable or not, I think you're in a pretty good place.
I know, right?
Okay. Tell me, how do you identify, and then tell us a little bit about your personal background.
Yeah, so I identify as an African American woman, and I also am a minority-owned business owner, Jenkins Public Health Consulting. And what was the second question? Sorry, I probably should pull them up.
A little bit about your personal background.
Okay, and just a little bit about me. I'm actually from Indianapolis, Indiana, born and then raised in Kokomo, Indiana by my grandparents. And at a very young age, they really had us volunteering in the community, which sparked my love for people and understanding at a very early age that it's important to give back and really make sure that people have access to resources, not just giving them any type of thing, but making sure that what you do give them is quality versus what you're saying or what you're giving them, maybe clothing. So that really sparked a lot in me. I wanted to be a pediatric surgeon um, first. And then when I worked in the hospital, I realized people were so sick from a lot of things that could be prevented. So at Ball State, I actually changed my degree from nursing to public health. And from then, it's been just a really amazing experience.
Okay, awesome. Well, firstly, I want to ask just about a little bit about the volunteering that you did that your grandparents led you into. I don't want to say forced you into, but led you into that made you grow an appreciation for type of public health work that people probably don't get an exposure to early on that you did. So to talk a little bit more about that.
Yeah, I would definitely say it was not forced. It was at least not for me. And I don't feel my siblings felt forced either because we really enjoyed it. It was 6 of us in the household at once. And we would spend days during the week or weekends serving the mission breakfast or lunch, folding clothes, taking food to people's home who were sick or shut in. And then also we would spend Christmas or Thanksgiving serving food, and which was really nice. And then we'll have our family Thanksgiving a different day. Well, we would serve the day before Thanksgiving and then have our family Thanksgiving. So it was really nice to see the impact in the community. And then it was also big because we saw how many people really needed us. It wasn't just like, oh, a couple people. It was a big impact, a big amount of people who really needed us, and how every encounter you have with an individual does matter. You know, like your bad day shouldn't be someone else's bad day. And it really, made a change for me in that as well.
Yeah, absolutely. It seems like you also learn like a lot about empathy and
Yes.
and that's a skill that a lot of people are lacking these days. So I'm glad that you were able to cultivate that very early on.
Yeah.
So tell me, what does public health mean to you?
Public health means to me access, like health equity. I love health equity. It means so much to me, really mainly because of my background, as I just talked about. But effective resources, quality resources, right? I tell people when they give donations to Goodwill or shelters, don't just give them holy socks and shirts. Like, would you like that if that's all you had? So giving quality programs, quality resources, and really connecting with them in an authentic way. So that empathy, that's what public health means to me, because if we don't have a lot of those things, no matter what program we have, no matter what resource we give, people aren't going to receive it because they don't trust you or they don't think that you're going to provide the best quality. So they might keep searching for something bigger. So I think public health is really about access and being authentic in the connections that you make.
Yeah, and I like the part about like the authenticity and because like you could come into a community and then you say you give them all holy socks, they're not gonna want you to come in and do whatever positive work later on. So I think it is really important to understand how you're approaching the community and
yes,
showing up in your work as well.
Yes, exactly.
Okay, awesome. So you got your bachelor's degree in public health science and interpersonal relationships at Ball State University. You said that you started off as a nursing major. So tell me about the thought process of like just going to university. And you also said that you wanted to be a pediatric surgeon. So tell me all about this.
Yeah, I mean, I've just always loved babies from a very young age. And when I started to job shadow and do internships and things like that, it was beautiful, but it was just too painful for me at the same time. And just going into the hospital and seeing these things like injuries, chronic diseases, other things like that, that can be prevented outside of the hospital through education, resources, connections, really having that community with you at the table when you're developing programs. I knew that I had to figure out what degree could I use to get to that, because I didn't want people to be sick. I didn't want babies dying through preventable injuries or just lack of awareness through parents. So that's what made me change my scope and go to Ball State University to pursue public health education. I went to Indiana State initially to pursue nursing, but then transferred to Ball State University for public health.
Really? Tell me a little bit more about the nursing and choosing to wanting to go to Indiana University to do nursing before we get into the public health parts of it.
Yeah, so Indiana State was just a choice right after high school. I didn't really do my research about the college before, but it was an amazing experience there. The nursing program, I was into my first year, so I didn't really get into all the in-depth nursing pieces of it, but I already had started interning and doing a lot of job shadowing at hospitals even before then, because my church, one of the staff members, church members was a doctor. So I had a way to job shadow her, and that really opened my eyes. And then when I went to Ball State University, right before I changed to public health, I did some job shadowing at the hospital there. So that was a big eye opener, because I was shadowing on the diabetes side, intensive care unit. I was able to go to the baby unit as well a few times, and it really opened my eyes there. And then that led to the transition to public health education.
Hey, yeah, that is awesome. And I think, as you said, like you had the opportunity to shadow from just knowing someone in your network from your church. And I think a lot of people sleep on those other networks where they might have valuable connections, where they can get experiences or knowledge or just some insights from other people. So I just want to make sure that I point that out so other people out there can realize that they probably have value in their network and they can access that and get value from that just in general. So thank you for sharing that.
Yeah, it changed my life. I don't think without that experience that I would be in public health, a public health educator, because I was so focused on, being this nurse or this pediatric surgeon. Without having that job shadow experience, I would have probably still pursued it and maybe feel heavy in my current role because of the emotional impact, and then really wanted to make a bigger change. Now, of course, we see people who, have nursing degree and health education degree, but I'm very happy with the path that I've chosen to take.
Yeah, well, I'm happy with your path as well. We love public health people on this show.
Right.
So tell me, you were doing this nursing major for a year, and then you said you were doing some volunteering at a hospital in different units. Where did you learn about public health?
Okay. I learned through public health, learned about public health at Ball State University, because they have a really great public health program. And then really volunteering with the American Red Cross, which we'll touch on a little bit later. They gave me a lot of opportunities to create programs and do a lot of on the ground work with the community about education and impact and advocacy. So that was really big for me. And just those things combined, Ball State had a health education and promotion program, and it was a great program, had some amazing professors who I still am connected with today. And they really encouraged me and led me into that program and really mentored me to have a lot of the successes that I still can speak on today.
Okay, that's great. And I'm glad that you were able to get some information about public health when you did switch across the Ball State. So when you did switch, what was your major? Did you switch straight into public health sciences?
Yes, from nursing to public health sciences.
Okay.
Yeah.
And how did you also come across the interpersonal relations part of your degree?
Well, I knew I didn't want to just graduate with a bachelor's. I had additional credits to get this interpersonal relations minor. And it really helped me to understand the why behind people's thought process. psychology, and really just different ways to understand how to connect with them. So there was a really good program for that at Ball State as well. Some classes that led to a program, and it was impactful as well.
Okay, awesome. So during your time at Ball State, you had an internship at the Delaware County Public Health Department. So tell me a little bit about how you were able to get this, and then what kind of things did you get to do in it?
Yes, so that was awesome. I was able to get that because it was one of the requirements of the public health education degree. And I was just calling around really. And really, when I got into the Delaware County Public Health Department, I was connected with an amazing supervisor, Tammy, and she really offered a lot of opportunities for me to experience different things. And it was a very small health department, still is, but they had so many learning opportunities to really continue to grow yourself as a public health educator. I created newsletters for the county, wellness newsletters. I conducted presentations about recycling and why people don't. I did lunch and learns. I did meditation sessions, pool inspections, food inspections. It was so many different aspects of public health. And also I educated college students about vaccines. And so it was a really unique opportunity that I never imagined would lead to this. And I can still speak on and talk about those experiences. And I would say the presentations and the lunch and learns really shaped how effective those can be when you put intention behind it and make it engaging for the audience that you're reaching.
Okay, so as we're on that, tell me how do you make an engaging lunch and learn for participants?
An engaging lunch and learn? Well, maybe you can provide lunch. Number one, I would say provide the lunch. But if you can't, I always like to do questions like icebreakers, even a piece that's like meditating or something that's having you think deep about a posing question, I say, versus just going straight into the education piece. How can you get them involved? How can you get them comfortable with you? How can you make them laugh? And I think when I did those things, people really grew trust in me, even as a young intern, trying to educate these people who've probably been working there, 5, 10, 15, 20 years. And it was really successful and people really wanted more of that. So I think when you can connect with people in those ways that I just gave examples on, that can make it pretty successful.
Yeah, and food definitely helps. Food definitely helps. That's
the incentive.
For sure. Okay. And then also during this time, you spoke on a lot of different things. You said you were doing these lunch and learns, newsletters, presentations, pool screenings, pool inspections, other inspections. How did you learn to do all these things? Was it that you learned it through school? Was it that you learned it on the job or on the internship floor? Like how did all that go?
Yeah, I asked her I wanted everything. I wanted to make my internship worth it. I didn't want any downtime. And my internship was January to May. And I fulfilled all those hours to make sure I was learning something every day, doing something impactful. Some of the things I wasn't always enjoying, but it was part of the learning process and it really shaped me here today. But when it came to like the food inspections, I would go with them on their inspections and learn the ins and outs. And now it still impacts me today. Like I've been meal prepping ever since. I bring my lunch to work, and I try not to be critical when I see things, but it's still, I'm still able to look back on those opportunities and see the impact and educate people about the importance of those different positions within public health.
Yeah, and I think like another important thing that you said there that was mentioned is that you went into this position and you're like, give me all the opportunities, give me the chances to learn. I don't want to have any downtime, and I think that's hugely beneficial, especially early in your career when you come into public health and there's just so many different things and you're like, I don't know what I want to do, I don't know what I like, I don't know what I don't like. And I think that in itself is just a great way to get your foot in the door and understand more so what you can do in public health and what you feel
Yeah,
comfortable with. So that's
it
awesome.
really opened my eyes. I say health departments are a great um, way into public health. I mean, it's might seem small, but they do so many things that can give you amazing experiences and help you pursue a passion in public health. I mean, there's epidemiology within health departments, as we know, but it's really, I don't want to say it's hard, it's not hard to get into, but it's, it can be a challenging, but to me, I think if you put the work in, you can get in.
Yeah, yeah, absolutely. I think public health departments on a whole are just underappreciated a lot.
Oh yeah, they're amazing. I'm like health department all day.
Absolutely, absolutely. And then you mentioned this earlier that you were a volunteer and advocate at the American Red Cross, and
Mhm.
you're talking about how you're able to do a lot of programming there. So, firstly, how did you get involved with the American Red Cross?
Yeah, so at Ball State University, I met one of my still best friends today, and she was a volunteer with the American Red Cross. And that connected me there in Muncie, Indiana. And during our time there, we did the Pillowcase Project, which was to educate children 0 to, I can't remember the age range, but the Pillowcase Project to educate kids about what to put in their pillowcase when there's a home fire. And I believe at that time it was sponsored by Disney. So they had like Disney themed pillowcases that they could draw or color and really educate them in a fun way. Um, and then we did the home fire campaign to go to different people's homes and educate them about why it's important to change your smoke detector. We would change it or install it for them and create an emergency plan for them. So we would canvass communities that had a high rate of smoke or fires and do that type of education. So it really put me out there to challenge myself to speak to random people, to go in people's homes pre-COVID. This was uh, several years ago. But I still am a current volunteer for the American Red Cross. And I serve various counties and cities in Indiana. And when I moved here in 2019, I was hoping to do the same work here, but COVID. So a lot of things are still on pause, but there's still some virtual opportunities people could be a part of as well.
Okay, that's awesome. And what is that process like for if someone does want to get involved with the American Red Cross, if you're familiar?
Yeah, so I mean, typically it's pretty simple to become a volunteer with them, but they do have an onboarding process that you have to do some training to understand, their mission and their why. And depending on what you want to do, because there's so much, you can either recruit volunteers or you can do some of the projects or programs that I mentioned. You would have to do trainings for those before you would be out in the field. But it's really simple, but it's a lot of fun, and it's life-changing impact that you see for sure. And they also have like disaster action training, where you could go to people's homes after there's been a fire to provide resources to them.
And then, so because yeah, I want to say like not too long ago you mentioned that you learned a lot about like public health from this experience. So, just
Mhm.
talk a little bit more about that.
Yeah, so public health is prevention. Public health is prevention. So really helping people understand if you have these things in place, you can prevent losing your house to a fire or prevent an injury due to a fire or death due to a fire. And then with the educating the kids, there are education pieces that we are talking to the kids about preventing fires, like not putting metal in the plugs and different things like that. So a lot of injury prevention is what the Red Cross is all about.
Yeah, and public health is prevention, so that I absolutely
Yeah.
agree with, agree with that. So thank you for sharing there. And then, were there any other takeaways that you had from your time in undergrad?
In undergrad, the other takeaways, just get involved. I think we undervalue the importance of volunteering and how that can still get you in the door for your dream job. I think companies obviously have these requirements, 3 to 5 years experience, but sometimes it doesn't even specify if it's paid or unpaid. So I always encourage people to still apply and really sell your volunteer experience as that paid experience because of the time you spent working or volunteering with them. And if it directly relates, I also would say to volunteer in places that directly relates to what you want to do after you graduate. Don't be working for an accounting company if you want to do public health. I'm not saying don't do it, but do something that aligns with what you want to do after graduation so that it's easier to find an employer.
Yeah, absolutely makes sense. And I think like volunteering is such an underrated thing
Yes.
that people can utilize just to get involved as well as meet people and meet the
Yeah.
community as well.
Yes.
And get all that hands-on experience. And yeah, like I definitely did quite a bit of volunteering myself at different hospitals under my undergrad, during my undergrad until I got into my my master's of public health as well. So
Yes.
yeah, so you graduated from Ball State, and then
Mm-hmm.
what was your thought process for going job hunting after then?
Well, I started my job hunt before I graduated college. I knew so many people who could not find a job after college, and that was really my biggest fear. I truly was not worried about it because I just walk in faith, but I knew that I needed to set myself up months before I even graduate to have a job after graduation. Whether it worked or not, I didn't know at that time, but it actually did. During my internship, I made those connections. I talked to random people. I wanted to go to these 3-day conferences and sit through 8 hours of people talking because I met this one guy who gave me my first opportunity after college into the field of public health, full-time, a full-time position. So yeah.
Okay, yeah, that is awesome. I definitely didn't have that mindset coming out of my undergrad. Definitely did have it coming out to my master's of public health, and I was able to get a job / fellowship like 3 months before I graduated. Also, so tell me more about that process for you of knowing that you don't want to be unemployed after graduating, and what were those kind of steps that you took outside
Mhm.
of I guess, yeah, just what were those steps that you took to really position yourself to be successful?
Yes. I think when you collect people's business card, really utilizing it, I know we probably don't do business cards like that anymore. Maybe connecting with them on LinkedIn and following through and just keeping them updated. I bet if you've asked my connections that I've even had for 10 years, I talk to them regularly on LinkedIn. And I think it's been a great platform for me to stay connected. But the individual at that time that I met, I never even knew that he would have an opportunity or even offer an opportunity even years later. So staying in contact with that connection, making intentional connections, walking up to random strangers and saying, hey, this is who I am. I heard you work for this company. Can you tell me more about it? You know, show your interest. And I think that could make a big change.
Yeah, absolutely. That's some great advice there. So after you graduated, you were able to get this environmental health specialist job at Marion County Public Health Department. So which state is this in?
Indianapolis, Indiana.
Okay, so this is in Indianapolis. So and you said this is the job that you got through that connection, correct?
Yes, but I did work as a community health screener first with the Marion County Public Health Department. So I had multiple promotions through that company, well, that organization, which was a blessing. So I started out as a community health screener, and I did audiometric and audiometric and vision screenings for children in all the schools in that county. And that was great. That was a great entry level job for me, which then I connected with that individual again, and he let me know that there was a job opportunity. He actually can't even think because there's a lot to the story. Do you want to start over a little bit?
You can tell me the entire story. I'm here for it.
Okay. So during my internship at the Marion, during my internship at the Delaware County Health Department, I had met him and we did a lot of work together when it came to pool inspections and chemistry behind it. Then there was an opportunity at the Marion County Public Health Department in Indianapolis, Indiana, that he talked about the environmental health position opening up, which was pool inspections full time. And that was really awesome. That was probably one of the funnest jobs I've had in a long time. I would go to these different pools, make sure that they're following injury prevention guidelines, making sure they're not, making sure they're keeping up with their chemicals to treat their pools. And it would be from like LA Fitness to community centers to country clubs, so public and private pools. And it really helped to prevent like pneumonia in people and other diseases. And so I thought it was pretty rewarding. And when I would, write up inspections, I would put my feet in the pool during the summer days, and it was pretty cool.
Yeah, that's awesome. That's awesome. So what are audiometric screening? What is that?
Hearing screenings and vision screenings.
Okay. Just making sure in case anyone else didn't know, because I didn't know.
Yeah.
Okay.
Yes.
And was there a certain school age that you worked with for that or no?
Yes. So we worked with first graders to 12th grade students, or first to 11th grade students.
Okay.
And it was actually more important than I even thought it would be. I remember the days when I would have to do the screenings as well, and I thought it was a joke, but there are people who actually aren't even identified until these programs come into the school and screen them, that they have hearing problems or vision problems. And then the teachers then realize, okay, that's why they're not doing well in class, because they actually can't hear and they actually can't see. So once that's identified, they are able to, create a program with that child and family, get the things that they need. And a lot of the times their grades end up improving. So yeah.
That's awesome. That is great work, and it's not something that you really think too much about, I guess,
Right.
And especially like I know like we talk about the part of like hungry children come to school hungry and they can't move, but it could be a kid coming to school and they just can't see the board, or
Yes.
they can't hear the teacher, and
Yes.
and then they're labeled in this certain way or that way. That's fascinating that isn't something that is done like just generally population wide audiometric and vision screening.
Yeah, I'm not sure if all health departments do it, but it's required by the state of Indiana for that to be done. So yeah, I would think maybe in other states they're requiring that as well, but yeah.
I'm gonna look into that, and if anybody else wants to look into that, look into it and let me know. Okay, so you started off as a community health screener. Was your next job the chronic disease health educator, or was your next job the environmental health specialist?
Environmental health specialist.
Okay, so tell me about that shift or promotion, and then what did you do in it?
Yeah, so with the environmental health specialist, I did the pool inspections, and that was really cool. I did like 500 pools a month, and from LA Fitness, like I mentioned, to community centers, and we would test their pools, and we would look at their logs to make sure that they're actually testing their pools, what time, because there were certain requirements behind that, and that they had safety protocols in place. I closed a lot of pools, and I remember a specific time I ended up closing this company's pool. I closed like 3 of this company's pools, and I didn't know it. And they weren't happy at all, because it's the weekend and you can't open up until Monday, and if you're caught swimming in a closed pool, we'll fine you. So it was an interesting experience, but we had to educate them as well about the importance of keeping your pools at the right chemical level to prevent certain diseases, injuries, etc. And I think it was a very rewarding job. It was just hot.
Yeah, that's awesome. That is like the public health work that people don't think about, like just go into those pools and being safe there, but someone has done all this monitoring and evaluation and making sure that it is safe for you. So I think that's an awesome public health example just there that people do not think about on a regular basis as well.
Right. It's not as simple as opening up a pool. You have to have certain safety measures in place. And depending on the size of the pool, that's when you'll see a lifeguard. And if this pool is under a certain size, you won't see a lifeguard, but you'll see the sign that says no lifeguard on duty. So they have to follow those certain things, and we pop up on them, and half the time they're not expecting it. And it's really great when we see someone actually, who cares about their pool and making sure that public is not getting sick and following protocol.
Okay, and when you did have to close down those pools, what was the biggest reason for that?
No chlorine in a pool, which is like horrible because it's not fighting any bacteria or the things that are naturally on a human body, right? You probably have oils, you have stuff in your hair, just sweat. So when the pool has all of these different people in there and you don't have any chemicals to fight those bacteria, people can really get sick, especially if you're swallowing a little bit of water, whether you mean to or not. And it can lead to different, diseases like pneumonia. So yeah, it was very interesting, and we have to lock the gate up. We had our own separate locks, and people could jump the fence if they really wanted to, but I think they steered away from those hefty fines.
Yeah, I would definitely try to do that as well. Not jump the gate. Stay away from the hefty. Stay away from the hefty fines.
Yeah.
Okay, awesome. Well, thank you for that work, and like that's something that I haven't heard a lot of people speak about, but I think it's very, very, very important work. You said 500 pools a month. That's a lot of pools.
Yeah, I was busy. It was so much, and that I was a team of, I believe, 7 of us. So, we had different parts of the city, of the county, and we were all busy all day, out 8 hours a day doing pools. And I didn't have AC in my car at that time. So I had bought my first car. I didn't realize it didn't have AC because I bought it in the winter. And come summer, I had a good outdoor job, and I was basically hanging out the window driving because it was so hot. But I would then cool off at the pools that I inspected, so it was great.
Okay. Let me just say a little bit more about like the background work of that. So let's say when you're testing a pool, do you have everything to do the test by yourself, or are you getting the sample and sending it off to somewhere else?
Yes, so there is a state test that I had to take as well. That was a 3 to 5 day training I had to take with the Indiana State Department of Health and had to pass. And I'm actually still certified as a certified pool operator. And that was several years ago. I can't even recall the year. So I had to do that. But then we are giving a really unique test kit to take to all the pools. And we also take a sample of the pool water and submit it to the laboratory at the health department, which is really cool. And they do the testing on that, and they follow up with that specific pool place to let them know, if you pass with E. coli or other bacteria in the water, and if they need to open or close. Also, the pools are required to submit weekly testing as well. So not only were we going out there to test the pools are required to uphold a certain test as well with the health department.
Okay, well, that's all good to know. I know it's starting to get cool again, but there are some pools that are definitely still open. So I'm glad.
Oh yeah.
Glad to
Oh
know
yeah,
that
we test in and outdoor pools, so you should feel pretty safe.
year round. Awesome.
Yeah.
Awesome. Okay, and then so you shifted or got promoted in this role to a chronic disease health educator and communication specialist. Are these two roles that you did concurrently?
Yes, it was within that same department. I had both of those roles. It was really awesome. And so as a chronic disease health educator, I did a lot of tobacco prevention education. And I also chaired Smoke Free ND Coalition, woo woo. And that was a great opportunity. And so we would do a lot of advocacy work and program development, grant writing, just so many different efforts related to tobacco cessation prevention. And we did some neighborhood audits as well. We would see where there were a lot more gas stations and convenience stores by zip code. And obviously we noticed that there was a lot more gas station, convenience stores, and tobacco shops in the low income area. And then that's where we would focus our program efforts and advocacy efforts. So that was really cool. As also, while being a chronic disease health educator, I helped with a cardiovascular program, which was like a screening to see, your cardiovascular health, diabetes education. I facilitated classes for that, sodium reduction program, physical activity, and so many more. And so it was really a unique opportunity to be a part of that department. And that work was just so amazing. It was always something new every day, since I was able to assist with various topics in the field of public health in that one department. So it really taught me a lot about managing various topics and becoming, staying organized and becoming that resource person, and why it's important to do effective education and outreach. Then as the communication specialist, I handled the website for the tobacco cessation program. I handled the media pieces of all those different programs if they had any type of event or news that they wanted to get out in the public. And I also did newsletters and things like that.
Okay, awesome. How did you stay organized?
Man, I I don't know. I like to write things down. I like big notebooks, and I use my planner. I'm a big person. I like having my planner. So that really kept me organized, and just keeping different tabs for the different programs. Because we did some pedestrian safety programs as well that took a lot of my time, but it was a big deal. We had to make sure that there was no mistakes for that one, because we were dealing with the community, especially because we had the community at that table for that program. So we wanted to make sure it was as effective as possible, organized as possible, timely. We stuck to the deadlines and everything. So it was great.
Okay, that's awesome. And then also in you speaking just now, you said you were the chair for Smoke Free Indie. So
Mhm.
tell me what kind of responsibilities did you have as a chair for this?
Oh, as the chair of the Smoke Free Indy Coalition,
Mhm.
it was challenging. It was challenging to make sure that every meeting was engaging and that it was meaningful, that we didn't just have, meetings for no reason. We had reasons behind every meeting, and that we had all the organizations at the table that aligned with our work, but also we were able to assist them with their opportunities as well. So it ended up being a very great experience, because I had to learn how to, sit down and have challenging conversations with people to understand how can you help us with our work if you want to be at the table, and what do you need from me for us to have that type of relationship. Kind of maybe you've seen on my social media posts, you scratch my back, I scratch yours. So really having those conversations, and then really figuring out what's important, because there's so many advocacy efforts when it comes to an organization, and following through and having the right people at the table, whether it's a community member or a decision maker.
Okay, thank you for sharing that. And then also during your time at the Marion County Public Health Department, you decided to get CHAS certified, or Certified Health Education Specialist.
Yes,
What was the thought process for getting this certification?
yes. And that was an interesting process, because I studied hard. I didn't take it right after graduation, which is highly recommended, because that's when all the information is fresh on your mind. And I wanted to get it so I could make sure that I'm keeping my education up to date, and then I'm also standing out as the expert in the field, one of the experts in the field. So that's why I really pursued it. But I failed it the first time. And I was so bummed, because I missed it by 3 points. And I was like, you know what? I don't even need to do this again. It was several $100s,
Mhm.
several months of studying, and I had test anxiety. So I was like, I didn't want to sit through a 3-hour test again. My husband, he encouraged me to take it again, focus, sit down and really study hard. And I got a mentor, and she really helped me to outline the importance of it, what sections identify, where my challenges were on that test, and what was the bigger issue, my test anxiety. So I had to go about the test a different way. And it was funny, because this was the test that was in person at the time. And my second round taking it, I took 2 breaks. I was like running up and down the hall, doing jumping jacks, doing some deep breathing and meditation. That was just my way of getting through it. And I ended up passing by like 13, 15 points. So I was very excited to pass the second time around. And I think it's been very beneficial to my career and my consulting business as well.
Yeah, that's awesome. Congratulations. Um, I want to say you were you the one that posted something about feeling your chest today on Instagram?
Yes.
Okay, that's good. So I actually want to hear more about that. I want to hear more about like the thought process of persevering, and or what you learned from feeling it, and like as you said, you didn't really want to take it again, especially like
Yeah.
with all the testing anxiety that you have and all that. So tell me about all that thought process in your head. And you said that your husband helped you to get and do it again. So talk a little bit more about that.
Yeah, I just felt defeated. As a recent graduate, I did not have any money at all. I put myself through college financially, other than student loans and grants and scholarships. So I really didn't have enough to try to take this again. And the exam is only offered twice a year. So it wasn't like I could just take it again. After studying really quickly and a few things, I had to wait almost, I think, several months, or if not another year, to take it. I believe it was another year. But the thought process behind it is I couldn't accept failure because I didn't want to make that a pattern in my life. And I had to keep moving forward and say, okay, if you want this, go get it, period. And then knowing too that there wasn't a lot of certifications or credentials that I could get when it came to becoming a health educator. Of course, I can get an MPH or a PhD, but what other certifications can I get now to help me stand out in the field? And that's what I did. I went and got it again.
Yeah, kudos. I'm glad that you did that. You stuck around and pushed through and persevered and did those jumping jacks and deep breathing and meditation and was able to pass the second time around. Kudos to you. So then after your time at the Marion County Public Health Department, and I think in your current role right now, you're director at a world-renowned medical center. So how did you come across this role? Did you come into it directly as a director, and then what do you do in it?
Yes, so my husband's job transferred us to Nashville, Tennessee in 2018, and I actually came in 2019 because we had to close up all of our business in Indiana. But I applied to jobs as soon as I found out we were transferring, which helped me to find so many different opportunities that I interviewed for. And I came across this opportunity, and I came in as I was hired as a director. It's been an amazing experience working there, leading statewide programs, handling toxicology blogs, doing epidemiology work, grant writing like no other, about 18 grants. So it's been a unique opportunity to create these different programs that impact all levels of the community. But it was truly just doing my research. I had zero connections in Nashville, Tennessee. We do not know anyone here. So it was really just walking in faith again and doing all the hard work, changing my resume, updating my CV, and really putting myself out there.
Yeah, absolutely. So tell me more about, before this role, you were a chronic disease health educator and communications specialist. And now you're transitioning into a director role, which I'm guessing has a lot more responsibilities.
Totally.
So how did you cope with that transition and really thrive?
Yeah, honestly, I think the position as the chronic disease health educator helped me so much becoming a director, because as a director, I only handle one program topic, but as the chronic disease health educator, I handled 6 or more topics and different initiatives every single week or month. So it was very, very demanding. And then I changed to this position, and it's one topic, which is awesome, right? Because you don't have to remember all of these 100 different program topics, but it really helped me to understand the impact of becoming the expert, becoming developing effective programs that reach all levels of the community. Because when I was doing the chronic disease health educator, we were only reaching the county level, but now we reach the county, state, and federal level as a director.
Yeah, and tell me more about that, about having to reach those different levels and how you're able to do it.
Yeah, so we collaborate with UT Extension to make sure that we're able to put our program at all 95 counties in Tennessee. Then we have just the media helping us put our information out there, and then writing letters to the legislators and making sure that our reports go out to them when there's pertinent information that needs to be heard or voted on for the passing of laws or supporting us financially.
Okay, that's awesome, and I'm glad that you're able to shift into this role and seems like really successfully take it on.
Yeah.
Were there any hard challenges coming into a director role from your previous role?
I would say, interesting enough, and this might not be a big deal to others, but I thought coalition building was very similar to a community board, and they're very different. That was a big challenge for me, really understanding the difference between the community board and the coalition, and if it's a advisory board or if they're a governing board. So that is a really big deal when it comes to nonprofit, and understanding those differences can be pretty detrimental if you don't. And thankfully, we didn't have any any bad things happen, but it was a learning thing that I had to really do my research on, reach out to some connections who actually were, the board chair, and see how I could help to improve our current board.
Okay, and tell me what are the differences between a coalition and a community board?
Well, coalition, they're both volunteer, but with a community board, they're really helping directly with fundraising efforts. They're really helping with your organization's strategic plan. With your community board, you're not really helping them with their efforts at all. They come to your board meetings to help you with your efforts solely, and to really help you improve your organization or your program, help fundraise, and many other things. It's just a really different piece that I didn't understand at first. Also, there's requirements. There's a lot more legal documentation behind that versus a coalition. There's not legal documentation from my understanding. But with a governing board, they're approving your budget. They're making sure that, staff is accurately doing things that they're supposed to do for the success of the organization, etc.
Okay, well, thank you for explaining that to me. Greatly appreciate it. I bet the listeners would also appreciate it as well, because it's not, I feel like especially community advisory boards are not something that you come across as often. Just typically people don't come across. You might know about coalitions or task force, but
right.
So I appreciate that a lot. Are there any other takeaways about your role in as a director that you wanted to share with us all?
Yeah, I think that CHES certification really helped me when it came to developing programs from scratch, which I do every year, create a program from scratch, and really making sure that we have the community at the table, or, those focus groups, the key leaders, health professionals who can provide that detailed input that makes that program really reach and become effective. We don't want to just create mediocre programs that aren't effective. So I would say really understanding the process of developing a program from start to finish.
Okay, that's awesome. And going back to the CHES for a bit here, are there any like solid things that you can see that you did differently from not passing the first time to passing the second time that you think people would get value from hearing from you?
I would say, obviously, studying early. Don't wait till the last minute. It's a very detailed exam, more than you would think. Every question is a multiple choice question, so you don't have just one or two options throughout 165 questions, so it's overwhelming. And every question is multiple sentences, so it's like 165 times 2. So I would say study ahead, use the resources that they offer online. But anything that I did differently the second time, I would say take a break. I don't know how the online proctor is going, but I believe if you're staying in the room and on camera, you can just take a break. Take a break if you can, because I think it was just so much information. It really caught me off, and I think I could have passed the first time if I took a break.
Okay, yeah, I think that's great advice, not only for the CHES, but in life in general.
Yeah, exactly.
Yeah.
Stretch, even if you just take a break to stretch, a little deep breathing or whatever your break looks like for you, just do it, even if it's one time. But I took 2 breaks, and that really helped me.
Okay, and it seems like that self-care part of your life is something that just generally part of your life. So how have you cultivated that part of your life?
Sorry, I don't understand the question.
So it seems like deep breathing, meditation. You said that you prepare your own meals. So I feel like all of that kind of self-care stuff that people mightn't take into consideration for like helping them with whether that's exams or just getting through like the daily trud. So yeah, how did you go about cultivating those kinds of things for yourself?
Yes, well, I'm a bit high strung. So my husband, he's the opposite, and he's really taught me to kind of like, just relax a little bit. You don't always have to have plans. You don't always have to be doing something. So, and even more recently, within the last several months, I've been focused on meditating and being present. And I think that's really helped a lot with just calming me down and really listening to people when they talk versus already being ready for having a response. But I think it helps with your nerves, and then just appreciating those conversations and the relationships that are being built, and just whatever's around you. And then getting outside. I still need to do that a lot more because it's crazy how life changes, with COVID. And now I'm in the home and I work all day on my full time and in my business. So it can be easy to let your day go by, but making sure you get some time out, like away from the computer, outside.
Okay, yeah, and I definitely agree with that. I definitely also struggle with trying to get outside as much as I would like to, for my
Yeah.
mental health and whatnot. But yeah, I appreciate you sharing that as well. And then as we transition into talking about your public health consulting, which you say you work full time along with your other job.
Yeah.
Your company's name is Jenkins Public Health Consulting LLC. So firstly, how do you balance both of those, being full time in both?
Yeah, I mean, it's an interesting balance because I still have to keep my full job. I'm not one of those people. I haven't met that goal yet to be able to quit my full-time job, but I'm very passionate about my full-time job and just staying dedicated to that. But I take advantage of my breaks. Either I'm checking emails or I'm handling calls during my break. And then right after I get off work, I start my consulting business work. And that keeps me up pretty late at night sometimes. So that's pretty much how I balance it. I take advantage of my breaks, and then, when I'm off, I go straight to work and go on my consulting business.
Okay, awesome. And then tell me more about the process for you wanting to start this consulting company. When did it start, firstly?
It was officially established as an LLC in March of 2021. But I had been doing some consulting business for over a year or more now. But I knew it was time to make it official because, you don't have a business unless it's official, right? Like they say. So I made an LLC in March, and it's just been a very interesting, challenging, positive, amazing experience, meeting various people from all over the world, thankfully through these, technology, and having to be at home due to COVID. But also I had to pass up opportunities that, were for me with the consulting business, because every opportunity either didn't sound right or it wasn't aligned with my business. So it's not that you take every opportunity that comes towards you, just really filtering out what's important and what aligns with you.
Yeah, absolutely. But I want to jump into the work that you're doing before you're an official LLC, and then we can get more to the
Mhm.
getting it official and whatnot. So tell me, firstly, what was your thought process for wanting to start this consulting company in the first place?
Yeah, so I really wanted to improve outreach efforts, period. I knew that that was a lot of the things that organizations that I either work for or volunteer for struggle with. Whether they were very intentional, they still weren't connecting with individuals. There was gaps in their resources, there was gaps in the implementation process, or even the program needed improvement. So really looking at all of those things, I knew I wanted to work with for-profits and nonprofits to improve their program efforts related to public health, right? With the for-profits, there's health and wellness programs with employees. How can we improve that? How can we get more employees to participate, to be excited, not to just keep offering these same old rewards for participation, but really to see outcomes. So I wanted to really help improve those outcomes, to improve health opportunities and connections.
Okay, yeah, and I like that. And I also want to say that in the beginning of what you said, you're like, there was a need because I've worked with these organizations and I saw that they would not getting this type of thing. And I think
Mhm.
that is very important when people are thinking about starting a consulting business. They don't just start it around what you are good at doing, but more so around what there's a need around, and are you
Mhm.
good at doing that, and then start it. I feel like is a better way to think about it.
Yes.
Okay, and then so how has business transformed from then to getting the LLC? Did you like add services, or was it just more that
Mhm.
in the beginning it was a lot less clients and now you have more clients, or the projects are bigger, or what has changed?
I wanted to protect myself legally because I do have some personal assets that I don't want to happen to get involved in anything. You just never know. Um, you just never know people's intentions, and then things just happen, mistakes happen, and you need to make sure that you have language in place to protect your personal assets and your business assets. So that's number one. That's really why I established an LLC, because things began to pick up. And also I wanted to be more serious in front of the clients that I served, because I didn't have a website. I didn't have anything that really structured me as a business. And I was kind of losing clients because of that. That's just like, anything I say, if you don't have a website or somewhere I can look and see your proof or your services, then you lose people. So I had to put those things in place, not only for the protection of my personal assets, but also to gain clients and for them to trust me.
Okay, yeah, that makes a lot of sense. Have what services do you offer, first of all? Let me ask that.
Yeah, so I offer a variety of services that help people improve their outreach efforts. And it includes like outreach strategy, program development strategy, social media, because you want to make sure people understand your program and are aware of it through social media efforts, whether it's your website or Instagram, Facebook, etc. I also do like coalition building. I help organizations improve or develop a coalition and make it impactful. And then I do various other trainings on public health topics and develop marketing materials as well.
Okay, all very important things. How
Yeah.
how does one go about improving a coalition?
Yeah, it's just really, I say you need to do an audit first, really assess where you are currently and then where you want to be, like what your goals are for even having a coalition, because every organization I say should have a coalition or a board, but sometimes you just don't have the manpower or the support to have a full-on coalition. But to improve that, every meeting needs to be intentional. Every meeting needs to have, action items for people to be working on versus updates every meeting. People can get an update through an email. How are we engaging them during those meetings? And what can we work towards as a coalition to build impact in our community or change policies, improve policies? So I would say those things.
Okay, and then on the social media side, what do you see people lacking most of the time, or on social media / website side of things?
Yeah, well, and there's really a little bit of a difference for the outreach efforts when it comes to the website and the social media, because with the social media, when you have your program, you want to have people understand what the ask is, what the need is, what your program is all about, how to reach you. There's a lot of organizations who don't even have a link to their website on their social media profile, and specifically, maybe even Instagram. And so really having those things in place for people to know what the problem is, how many people are you serving, what are your outcomes, what are your successes, what do you need from me, how can I volunteer? All of those different aspects, having that as posts on your social media really helps people to understand and want to be engaged or even share the resource.
Okay, yeah, and I think that makes a lot of sense too. And then earlier you're talking about how your business works with both for-profit and nonprofit organizations. So how do you go about doing your outreach for your business to these different entities?
Yes. And, when it comes to owning a business, I'll say this first, everything is a process. You're always working on your business. Things are always changing until I reach that perfect level. I have not yet, but I'm getting there. But to do that outreach is automation. I would say that I'm working on some ways to automate my business for me to do outreach on a more consistent basis, to make sure that people who are signing up for my newsletter and who are clicking on my website are aware of how to contact me or what's currently going on. But currently how I'm doing that is manual right now. It's manual labor, reaching out to these organizations saying, hey, I'm here. Thank you for, following me on social media, or, sharing my page. How can I help you? Or this is what I have going on currently right now. But then also looking at their websites or following them on social media and seeing what they're posting as their need, what they're posting as their program outcomes, and seeing, okay, is there a way for me to get in there and help them improve it? Or is there a way for me to conduct the training? Like, hey, I see you have a coalition. Can I conduct the training about helping to enhance those coalition efforts.
Okay.
Yeah.
Yeah, that makes a lot of sense, and I hope that you are able to automate it soon and take
Yes.
take that stress off of yourself and put it on a system. But
Yes.
I think that that's hugely important, especially as you try to expand your business. And as saying that, what does expansion of your business look like over the next year or so?
Over the next year or so, I plan to have a lot of my trainings on demand. And I'm very excited about it. I'm very close to reaching that goal. So plan to have a lot of my trainings on demand, do a larger coaching program. You may have seen a couple of things coming through on my social media about coaching programs, doing that through on demand as well, but then offering some live sessions. Yeah, just the coaching programs, the trainings, and then in person, whenever we get back to that state, or even currently virtual, doing a lot of trainings for organizations about various aspects of public health and coalition building.
Okay, yeah, I like that. I like the idea of having on demand
Yes.
sessions, because as well it takes the stress off of you, as well as just gives easy access to organizations that need the information. So I look forward to seeing how that does unfold.
Yes.
and everything like that. Before I do forget, how would someone contact you if they wanted to get in contact you for services that you offer?
Yes, you can either find me through my website, jenkinsphc.com, so jenkinspublichealthconsulting.com, or I'm on all social media platforms, including LinkedIn, Jenkins_public health on Instagram. You can follow Jenkins Public Health Consulting on LinkedIn. And then I'm also on Facebook.
Okay, awesome. And what advice would you give to someone that is working a full-time job and is taking on this full-time business and also trying to like grow this full-time business to possibly become their full-time job? What kind of advice do you give?
Yeah, so I'm still in that early stage, I would say, but for me, I would not lose sight of your full-time business, your full-time job first. That comes first, I would say. Yes, we want to be successful in our side hustle or entrepreneurial endeavors. However, you got to keep focused on what's bringing in the money right now. And however, if your side business is bringing in more money, then you don't want to lose clients because your full-time is in the way. So you really personally have to figure out your situation and what's best for you. But for me, I'm staying focused on my full-time, and then my side hustle is my side hustle. But I'm very, very passionate about it, and I love the people that I've been serving.
Yeah, and I think it's important that we, if we do or are able to have full-time jobs, that we use that to be the investment vehicle for our businesses, for whatever other investments you want to do. Let your full-time job be your biggest backer, be your biggest investor in you and the work that you're doing outside of your job as well.
Yeah, I haven't had to take out any loans or payments like that, because thankfully I don't need an outside. I'm working my business from home as well. So that's been funding. My full-time has been funding my side hustle, and I say that's a positive in that as well.
Yeah, and do you consider yourself to have a lot of balance between your full-time job, your business, and then just life in general?
I would say so. I mean, it's still a work in progress, but I know my cutoff times are very strict for various reasons. And then I would say my personal life, I enjoy my weekends with my husband and my family. I try to do that as much as I can. And then, when we don't have plans on the weekend, I'll work throughout the weekend and things like that. But I'm pretty much working on my side business, and people may think I work, show up full time to them, but it's really, preparing in advance for things and having things done. Because a lot of the times with these meetings that are not on demand yet, I'm running in the door from work to get on a 6 p.m. meeting because I have an hour traffic getting from work. So yeah, it's that type of balance as best as I can.
Yeah. I know it can be challenging, especially when you're so passionate about it and you're enjoying it so much, to really take those breaks. But as you said, like, you have your cutoff times, which I think are very important for your overall well-being and sustainability going forward.
Yes. Yeah. I mean, if you don't have to work overtime in your full-time, don't, and focus on your side hustle. If you don't really have this assignment that's due for 2 more weeks, then just, get home and work on your side hustle. Really understand what's important at that time. Don't mess up on what's coming in right now. And I feel like that's been really helpful for me.
Yeah, sounds good. Is there anything else that you wanted to share from your learnings of having this consulting business over the last year and some?
Um, just be kind to yourself. I know we see all these people who are having, 6-figure businesses overnight and just all these different things that I would not say are, schemes or anything like that, but your time will come. Stay passionate. No one is you. And you will do great if you stay consistent. And consistency is so hard because sometimes I'm not consistent. There's a lot of things I need to have done by Monday. I probably should have had done a couple days ago for my side business. But consistency is key. And just be kind to yourself, because at the end of the day, you're okay. You're okay.
Yeah, absolutely. And yeah, consistency is very, very hard. It's like, even for myself, it's like you could probably be consistent for a bit, and then you lose that discipline for one day or something, and it drops down, and then it's like nothing, and a period of no consistency, and then you get back into. So it is very challenging, but I think like it comes down to like that discipline, and not doing it because you're just doing it, but because it's set there for you to do, and you said, I'm gonna do this today. I feel like it goes the same for like working out or probably eating healthy. Is like there's so many emotional things in life that could turn you away from wanting to do it, but really setting the discipline and the time aside to do it, I think is so important. If that is something that you're trying to learn and grow around.
Yes, I have to set timers. I am not really a structured person, honestly, but I realized balancing 2 businesses or working full-time and having a side business, that I have to have alarms, because look, I don't want to miss my 12 o'clock because I have a call. I want to take advantage of my lunch breaks. And then if I don't have to work after 4:30, 5 o'clock, I need to set an alarm that, at 4:30, okay, 5 o'clock is soon, get ready so I can be out the door and get home to my next client, so that helps me set alarms, and then not working until 3 in the morning, because sometimes I just get in my mode. So I would say the setting alarms are helpful as well.
Yeah, absolutely. Is there anything else that you wanted to share about your business before we move on?
Not currently.
Awesome. Well, be sure to follow along, or whether that's a website or social media or on LinkedIn, and just tap in and just see how the value that Brittaney brings.
Thank you.
Yeah, you're most welcome. Like I enjoyed that post today about you feeling your chest. Not to say I enjoyed you feeling your chest, but I think like I love the transparency that people are sharing on Instagram or just in like social media in general about, like, because a lot of people view them as very successful, doing great things, not really fallible, but that's not true. We've all had our own challenges, and I think it's important to share that so other people can get motivated and inspired and understand that everything's not going to go your way all the time, and that's okay.
Yes, exactly. And I don't know if you want to cut this out, because I have a question. If I was allowed to pitch a program that I have going on right now related to that.
Oh, please, you're allowed to pitch whatever you like to pitch.
Well, so in regards to these posts that are coming out about the CHES exam, and I'm very passionate about the CHES exam. I think it does have a lot of value to your personal development and career development and opportunities. I believe that you can even ask for an increase in pay when you get that certification, and negotiate pay when you're trying to get into the door of an organization. But I have an impact program about the CHES exam, for the CHES exam. Open registration currently until September 16th, and we will be going through all things CHES and how to prepare, resources, tools, and what I did to help me pass my CHES exam. So I'm taking 20 people, and we'll have a waiting list if we get more than that, but it's going to be a really impactful program. And it's, I believe, 6 sessions talking about all the different aspects of the exam and how to pass. So if you know someone who's taking the exam, this October session, please have them contact me at Jenkins Public Health on Instagram or my website, and we'll get them signed up.
Yeah, absolutely. And I'll be sure to put that in the show notes as well. I will try to get it into the description of the podcast or the YouTube if you're looking at that there too. And I'll also be sure to mention it in my intro to the episode, that there is this thing that people can check out, so that people can tune in. Because I get a lot of questions, or just see a lot of people who do struggle with the chairs, or finding a way, or asking questions about what they should be doing because they're just confused. So I definitely think there's a huge need for that.
It's a lot of information. And obviously, well, at this time, if you're not signed up for this October test, you won't be able to sit for it. But they do have exams twice a year. However, the exam is changing. That's why I'm encouraging people to, make sure you're signed up as soon as possible, because the CHES is changing, I believe, for the October session next year. But you'll have to look on my post. I don't want to mess that up on here. But yeah, the exam is changing. Get in while you know people who understand the process currently. And yeah.
Yeah, absolutely. Because you never know when exams change, how much harder or how much more information or material they want to add into it. And it's essentially the same certificate if you get it today, or if you get it then. So I completely agree with you.
Yes, exactly. I agree with it. It's likely the same. It's no change in the title of the certificate. However, it's a longer framework. They reorganized it. Actually, I really love how they reorganized it. It's more clear and detailed. So maybe that would help the exam be more clear and detailed. But we never know. If the exam could be a lot harder this next round.
Yeah, absolutely. So be sure to sign up for that impact program if you're planning to take your CHES, or if you're planning to take it later on. I guess I'm still planning to take it. So yeah. Okay. So you have a certification in diversity, equity, and inclusion in the workplace from USF Corporate Training and Professional Education. So first, what was the thought process? Well, I'm guessing that you said that you love to learn, so I'm guessing that that the thought process was kind of about wanting to learn. But I guess if there's more to that, please share. And then what did you learn from this?
Yes, so the University of South Florida, they put on that DEI training, and it was a free training offered to so many people. It was a very short period to sign up. So a lady who I mentored actually gave me the contact about that, and I was immediately excited. I was so excited about it because oftentimes as a minority, people think I have all the answers to DEI, and there's still a lot I need to learn. And there's a lot of us who are confused on why these are still an issue. So I thought it was very important for me to be at the table, be a part of these trainings. And I believe it was a 6 or 8 week training through USF, which was pretty long and very, very deep and impactful, totally worth it. And I was just very, very grateful to be able to get that for free, which is typically over $1,000. It taught me a lot about my own biases, which I really identify that I have. Didn't realize, because I'm like this person who's all about all of community and all of the resources for everyone. But there's still biases that we have to make sure that we identify and see how it's impacting our work, because it does and it can. And yeah, I would say people should take it, whether it's free or not, just so that it helps you improve the work that you're doing in your community or your program.
Yeah, absolutely. And I think there is a lot to learn about diversity, equity, inclusion, and
so much.
No one person is going to know everything. And even if you feel like you're an expert, there's always more to learn.
Yes, exactly.
And I'm also glad that you stated that you had internal biases that you learned throughout this process, because I think all of us do have internal biases, and being able to check those and really understand that they're there, especially in public health where we're working deeply with community, is very, very important.
Yeah, you don't have to say it out loud, right? It's just really what you need to know internally. Be honest with yourself. That's all about personal growth. And when you can't show up authentically, people don't trust you. It doesn't matter who you are, whether in your personal friendships or family or work, people see it.
Absolutely. So before I move you on to the Furious Five, the last section of this show, I wanted to ask, where would you like to see yourself in the future?
In the future, I would like to see myself solely consulting with organizations worldwide. I want to make a big impact about effective outreach programs and improving program outcomes, not just generalizing outcomes or generalizing efforts, really making impact, because that's when impact in our community happens. I see myself serving people, like I mentioned, on the global level when it comes to all those efforts that really fulfills me as an individual. So that's what I would say I see myself.
Okay, awesome. I like that. I like that a lot. And then moving on to the Furious Five, the last section of the show, the 5 questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
The advice that I would give to a student trying to pursue the field of public health is get involved, whether you're doing volunteer or paid opportunities, get involved at something directly aligned in public health. It's really hard to nail down exactly what you want to do in public health because public health is so broad. You can be an epidemiologist or a community health screener. You can do food inspections or, pool inspections. It's just such a big thing that I'm not even touching the surface on. So many different positions, but getting involved in something that's directly related to public health and see how that opens doors for you for future opportunities.
I love that. Number 2, if you were talking to someone wanting to get into your position, what advice would you give them?
In my current position, like my full-time job?
Both.
Okay, so the advice that I would give someone is to stay organized and just take your time. I think when we're trying to rush and be everything at once, that's when mistakes can happen, or you can just be overwhelmed and feel defeated or burnt out. So just take your time and stay organized and just show up every single time and get things done early so that when that time comes, when you have your 6 o'clock meeting and you're running in the home, you are already ready versus being nervous or having a little anxiety.
Absolutely. Number 3, what's something you are working on improving in your life right now?
Currently, I'm working on automating my business. I think that's going to just be such an impactful thing because I'll be able to serve a lot more people at their time, whether they're up at 3 a.m. or up at, late, early, I'll be able to serve them. So really automating my business so that people all over the world can reach it and learn something from my outreach strategies.
Yeah, but I think automation is like key. It is key to a lot of things.
Yes.
Number 4, professionally, do you recommend anything besides your impact program?
Professionally, I have a lot of great contacts I could send you. I don't know like their social medias by heart, but yeah, I would say get on LinkedIn and continue to follow organizations that you see being a great example to the work that you want to do, whether it's full-time or for a consulting business. Find consultants that are already doing successful work where you want to be, and see, how they're doing their business for success.
Okay, awesome. And yeah, feel free to share those with me and then I'll just share them in the show notes.
Okay.
And last but not least, where can people connect with you?
Yes, I would say connect with me on Instagram and join me on LinkedIn, Jenkins Public Health Consulting Group on LinkedIn. I am really doing a lot of work on that to post more content and really engage people through that. I want to make sure that people are aware of job opportunities, program opportunities, and then just ways to improve their overall program impact. So follow me on there.
Okay, be sure to do that, and I will be sure to link all of those in the show notes for people to tap in and connect with you. So thank you so much for coming on the show and sharing your story and all your insights and all the great things that you're doing. I really, really appreciate it.
Oh, of course. Thank you so much for having me. It's been a pleasure. I'm happy we were able to connect.
Same here. Housekeeping items, everyone. Thank you for listening or watching. Be sure that you subscribe, that you like, that you leave a review, and you share with a friend. And if you would like to support, you can go to buymeacoffee.com/PH Millennial. And I will see you all, or you all will see or listen to me next week. Peace out.